Are we rolling?
Let's go.
This is the New York City Regional Emergency Medical Advisory Committee meeting of November 13th, 2018. Please answer when your name is called. Robert Winchell.
Here.
Joseph Schenker.
Here.
Michael Vatch. Robert Ackerman. Nicholas Alexandru.
Here.
Christopher Graziano. Eric Cohen. Mimi Langsam. Kevin Munjal.
Here.
Cindy Basilios.
Here.
Dario Gonzalez.
Here.
Glenn Aceda. Bradley Kaufman.
Here.
Doug Isaacs.
Here.
Nathan Reisman.
Here.
Reisman. Josh Buckland. Barbara Aziz.
Here.
Allison Burke. Jeffrey Rabridge.
Here.
Louis Marshall.
Here.
Michael Redlener.
Here.
Michael Hilton. Laura Ivacoli.
Here.
Stuart Kessler.
Here.
Pamela Lai.
Here.
Dominic Battinelli. Scott Chang. Peter Wire.
Here.
Paul Barbara.
Present.
David Benelli. Celia Quinn. Timothy Stiles. Yes, that's what he said. Timothy Stiles?
He's stuck on the subway on his way.
I know, he said he was coming.
Right, I heard that one before.
Mark Cantor.
Here.
Sharice Berry. Charles Martinez.
President.
Joseph Bove. Martin Grillo.
Present.
William Fisher.
Here.
Robert Krupe.
Here.
Jessica Van Voorhees.
Here.
Arthur Cooper.
Here.
Yadidja Langsam.
Present.
Anthony Shalish. Christopher Sorrentino. And, oh yeah, don't count the alternate if the primary is here. Right. 6, 7. Oh, you already counted? 9, 10, 11, 12, 13, 14, 15, 16, 17. We have a quorum. We have more than a quorum.
Okay. Thank you, everybody, for coming. First, I'd like to approve the minutes of the October 9th meeting.
Second.
Excellent. Next, correspondence report. Marie, do you have that?
Yes, I do.
Here?
Yeah, that's it.
Okay.
You can read the crossed out ones.
Excellent. I will do that. All right, the following correspondences were received. The following members were unable to attend and asked to be excused. Christopher Graziano, Scott Chang, and Glenn Aceda. Greater New York Hospital Association appointed Matthew Fink to fill the ambulance service medical director seat that was vacated by Wallace Carter. And Wallace Carter is the alternate. Greater New York Hospital Association appoints Matt Fink to fill its ambulance service medical director seat.
That is a seat that is part of the bylaws. The seat that's Greater New York is for an ambulance service medical director. Just like you have
Ambulance
online
service
medical control.
director?
Yeah, that's what it's called.
We need to vote to accept that.
It's their seat.
It's a lot of stuff to vote to accept.
Greater New York is just putting him in that seat.
All right.
And there, he's with New York Press.
Any questions about
Yes, you
that?
have to vote to accept it.
I understand we have to vote to accept it. Is there any questions before we vote to accept it?
Is he an ambulance service medical?
I don't know.
He is for New York Presbyterian. Well, Wally Carter is.
Right, so we might need a little bit of clarification from Greater New York in terms of if he fills that designation.
Okay, I can write to them and we'll bring this back up at the next meeting.
So you did it, will we vote and then send it to REMSCO anyway?
Yes.
Yes.
Okay. So we'll vote on whether to approve Matthew Fink to fill the ambulance service medical director seat for Greater New York, obviously with clarification from Greater New York. All in favor of this appointment, please raise your hand.
First, how can you vote without
Can I
clarity?
move to table?
We have nothing to do.
How can you vote?
Basically-
So we're voting to approve the appointment, and that has to go to REMSCO as well. If he doesn't meet the criteria, we can, I mean, I guess We can do it either way, I'm not really sure.
Can we table till the next meeting?
I think you should. I
Could
don't think you
definitely
should
do
vote
that.
for it.
Okay,
Alright.
yeah.
People want information.
Yeah.
Okay. From the fire department, the program agency first quarter report was submitted. The PCR monthly inventory control report was submitted. There were a bunch of non-compliant PCR form submissions. I'm not gonna go through the list. From the Department of Health, there was public notice from the New York State Department of Health, Bureau of EMS, to be read into the REMAC meeting minutes of the following enforcement actions. Juan Rosado, EMT number 338975, was assessed a $2,000 civil penalty for violation of 800.3 Part 1. He lives in Flushing.
I'm sorry?
Emails from different agencies regarding the placement of EpiPens in alternative settings were sent in. There was an email from Lilia Brukin regarding if there are any protocols for transfer of care from EMS to emergency department personnel. I saw this, this is specifically pertaining to when the transfer of care occurs when an ambulance brings a patient into the hospital. So we got updates from NYU Langone, updating the medical director to be John Reed Caldwell. There's a letter from Forest Hills Volunteer Ambulance Corps affirming training and medical director approval to use BLS IM epinephrine. A letter from Bensonhurst Volunteer Ambulance saying that they will be using epinephrine approved by the FDA for extended expiration dates. There were applications for EPCR from NYU Langone, Rapid EMS, and Ridgewood Volunteer Ambulance. And let's see what
And
else.
those need to be approved by.
Right, so this needs to be approved by the REMAC. We actually have to vote on, or actually approve, that these three agencies are using EPCRs. Why don't we do that now?
Move to approve.
Do we have to vote? Is this
Do we have to
a
vote?
roll call vote?
To
To
allow-
approve
to approve
EPCRs.
Yeah, what do we do?
Yeah,
Is
Yeah, I
that
think
a
we
roll
need
call?
to explain what this is.
No,
May I explain?
Nancy, if you would,
Thank you.
if you would.
Please explain.
Okay. The State Department of Health has put into place a process, and the process is that an ambulance, once an agency is ready to move into the electronic PCR world, it must receive approval from the REMAC, and then it gets submitted, that approval then gets submitted to the state. We're in the process, so it's a fairly new process, and it's now happening. And so it's Form 5136 or something or other. Those of you who have already been approved are fine. Those who are upgrading to NEMSIS 3 or changing their platform will need to complete this form. It's a simple bureaucratic process.
I mean, if anyone wants to see what the form looks like, I could pass, this is not like secret information. I'll
There's
pass it
nothing
around,
secret about
just give it back to me, and
We're keeping the secret information.
There you
secret
go.
stuff is upstairs.
We have it redacted. So it's simply just information so that nothing is a surprise to the State Department of Health.
Okay, so the form is going around, but essentially, let's do this approval as a hands vote. All in favor of approving NYU Langone Hospitals, Rapid EMS LLC, and Ridgewood Volunteer Ambulance Corps to begin using EPCR, please raise your hand.
Only MDs can vote.
Yes, only doctors can vote in REMAC.
Keep your hand on the wall about IT.
Yes.
9, 10, 12, 13, 14, 15, 16.
Anybody opposed?
She's still got your
Dr.
doctors.
Stiles is in the room.
Excellent.
There's more qualified.
Sorry.
Any abstentions?
Round up to 20.
Seeing none, we'll move on.
Okay, so it's
Okay, there was also the following correspondence were sent. Letters regarding thrombectomy center capabilities were sent in by Brookdale Hospital Medical Center, Kingsbrook Jewish Medical Center, Mount Sinai of Brooklyn, Mount Sinai Beth Israel, NYU Langone Brooklyn, were all sent in. And an invitation from Dr. Michael Arario was sent to the region, inviting people to join Presto to participate in pre-hospital stroke treatment organization consortium to advance stroke care. Any questions on those correspondences? No. Okay, good. Subcommittee reports. The executive committee did not meet since our last meeting. Medical Standards Committee, Dr. Benelli. Behind the pole, right.
So medical standards met just prior to this meeting. I don't think that there are any action items that are actually being brought forward to be voted to this committee. We discussed the test results from the certification exams. We discussed some protocols that are being in review by the protocol committee in order to make as part of the unified protocols that we're trying to achieve for this region.
And delaying the stroke until April 1st.
That actually has to be voted on. Yeah, so that's the one, we discussed, I'm just going down the list. We discussed, there's one action item that was that is being brought to REMAC for approval. That is to postpone the implementation of the new stroke protocols until April 1st, 2019. There are a lot of moving parts that have to fall into place. The state has published their proposed regulations for public notice. We have sent out just recently, a couple of days ago, in the beginning of the week, a letter polling hospitals to see who is going to participate in and become a thrombectomy stroke center. We have received a small amount of responses. We need to receive much more. It is apparent that we want to implement this not before the second quarter of 2019, and in view of that, the Medical Standards Committee has approved postponing the implementation of those protocols until April 1st, 2019, with the understanding that if we need to do any further changes, we will review this and discuss this again in January 2019. That's it.
Any questions on that? So essentially, we're taking protocols that were already approved that should be implemented January 1st and postponing the implementation of the stroke portion of that to April 1st at this time. Okay. Is that a roll call vote? Yes, we're
Yeah, it's a
changing the
protocol issue, yes.
So let's do that first, and then we'll move on to the next thing that David has.
Okay, so this is postpone. Stroke. Okay, so please respond in favor, oppose, or abstain. Robert Winchell,
In favor?
Nicholas Alexandru,
In favor.
Christopher Graziano, Kevin Munjal,
In favor.
Cindy Basilios,
In favor?
Dario Gonzalez,
In favor.
Glenn Esteta, Bradley Kaufman,
In favor.
Doug Isaacs,
In favor.
Nathan Reisman, Jeffrey Radrich,
In favor.
Louis Marshall,
In favor.
Michael Redlener,
In favor.
Pamela Lai,
In favor.
Laura Ivacoli,
In favor.
Peter Wire,
In favor.
Paul Barbara,
In favor.
David Benelli,
Yes.
Timothy Stiles,
In favor.
Mark Cantor,
In favor.
Charles Martinez,
In favor.
Joseph Bove, William Fisher,
In favor.
Robert Krupe,
In favor.
Jessica Van Voorhees,
In favor.
and Arthur Cooper. Step down.
So maybe we probably should
Thank
send
you.
a letter to that effect, right? Send out a letter, an update,
Well, you want the letter sent to the hospitals, or do we send it out
no, to the agencies.
Yeah.
to our EMS agencies?
Yeah.
Our EMS agencies haven't yet been sent the new protocol.
Oh, perfect.
So, yeah, it's safer not to confuse them.
Okay, very good. Yeah.
So this carried.
Okay, good. And then under new business, we discussed asking the CNC committee to actually review the credentials of EMS medical directors, ALS EMS medical directors in our system, and also to discuss with the TNE committee CME criteria. And also there was one more action item where Marie will ask for a form with standardized information on any CME brochure that is being posted.
So were any of those seconded motions coming
No.
forward?
No information, just information.
Good. Thank you. Any questions for Dr. Benelli? All right, seeing none, we'll move on to the QA report. Dr. Redlener.
So the QA committee has met twice since the last REMAC meeting, on October 18th and then on November 8th. We have discussed a number of items. One is the update of our membership, where the positions have changed. There are some openings that are being discussed. We're looking for a nursing position to be filled, as well as an EMT member that we're currently looking for and recruiting. Those members will be appointed by the REMAC, the chair of REMAC and the chair of REMSCO. We discussed two pending patient care restrictions that will be reviewed at our next executive QA meeting. We discussed the stroke items that we've discussed here already, so I won't go further into that. And another item is it has to do with patient safety. As many of you know, there's a national document put out on ways to combat fatigue in EMS. We know that the State Department of Health is working on similar documents, so we are holding until we see what they're going to produce about recommendations. In the meantime, we'll continue to work on our regional draft. There is a regional project around a QA tool called First Watch, which is a project that is grant funded in conjunction with the American Heart Association around STEMI and stroke care. We discussed this project and how the QA committee can participate and support the efforts of that project in terms of providing agreement and support to the quality measures that project will address. And I'm sure that more information will come in the beginning of next year around what the details of that project. There was also an item discussed around the New York State Department of Health's efforts to build statewide quality measures, and perhaps an opportunity to input into that effort as well. There'll be more information that I'll send out through Marie around how to submit those or how to over those. I don't know if there's more information or discussion from those who participate in REMAC, CMAC or REMSCO around that, but that's an interesting possibility that could affect the way we track and look at the different measures. So more to come on that. And that's all I have.
So I'd like to ask if anybody has any suggestions of nurses or EMTs or medics that would be a good fit for the Quality Assurance Committee. They must be a member of either REMAC or REMSCO, but it would be helpful if we could have a little more representation from other groups on the committee. And like Michael was saying, we would like to be the leaders in what quality metrics are important for both New York State, for our region, and hopefully nationally. If there are anyone who has specific metrics that they can consider important, forwarding that to myself or Michael or Marie, We will definitely start incorporating that into the quality metrics for the region. As the state starts to develop theirs, we should be leading the charge if we can. Any questions for Dr. Redletter? Okay, seeing none, training and education, Mr. Lax.
The Training and Education Committee met on October 29th. A couple of big topics that we discussed. With the first one was involving technology, utilizing existing technology perhaps a little better. REMSCO has a new website, making it perhaps more robust and utilizing areas that are currently underutilized there, as well as the REMSCO app, the mobile application that should be coming out soon.
Whenever.
Apple just reached the so.
Oh, they did?
just
Okay,
wait.
great. Okay, so that should be coming out soon, and these will all become great educational resources in the region. One thing that we're going to be reviewing is the possibility of posting instructor-level CME credit courses, including other core and non-core CME. We're going to add a link on the website, a page that will show the. One of the issues that was mentioned at I think from the board of directors is a brand recognition issue. I think that medics know that REMAC and REMSCO exist because they have to. EMTs do not. There's a lot more EMTs in this region than there are paramedics. So in that vein, who to contact for what, who and how to contact them. We're going to create a tab on the website that will have links to contact all of the committee chairs, so that people can kind of be guided in the direction they need to be guided in case they have questions. On that same vein, we're looking at technology such as perhaps getting a constant contact account that will people will be able to sign up for and be able to get notified about various things happening in the region, EMS related. More to come on that. Let's get that. We discussed the need to promote train-the-trainer courses for Stop the Bleed, maybe hosting our own perhaps, or a few of them. We've discussed several times already succession planning in terms of the various levels of leadership in education here in the region. Currently, there are probably 2 PCs that are still active in the region. PCs are needed to run instructor-level classes, both to provide instructor updates and to be able to make new instructors. In order to make more PCs, we need regional faculty. There currently really aren't many of those left. The state hasn't been making them, so several requests have been sent to the Department of Health to make more regional faculty. Perhaps we're looking at maybe making suggestions other than using the current paradigm that's used for this. We'll discuss that with the Department of Health and report back. Along the vein of that brand recognition is a newsletter that apparently many years ago was something that existed. So we hope to be able to launch by January our first quarterly newsletter that will enable us to push information out to providers, agencies, core sponsors, and so forth, that will hopefully at the same token pull them into the website as well to gain more information. The last, a couple more quick things. So stroke was a big one. So first, really big thank you to everybody at the fire department. This was a really big collaborative effort. I think this is at least the first time that I've been involved, at least in my memory, that there was such a big collaboration on a big regional program. One of the goals of training and ed has been to regionalize education, and this will probably be our best test to see if this works. I don't know if everybody knows about all the details of the training. I'll spare you the majority of the details. Just to put it simply, there are 2 videos that discuss everything. What the region is going to do is send out those videos. We're going to post them on the LMS with some testing, as well as a hands-on component that's going to be sent to the individual agencies, and that will come out as soon as the protocol comes out, so that enough time to train all the providers in the region is left. Protocol update. So we're looking to send out a training package as well anytime new protocols come out, at least big ones that require training. Currently, I think today, if you ask the various medical directors what their agencies are doing, they'll probably tell you that everybody is doing something different. So how that information is relayed, what training is done, there's got to be a way to standardize that as well, and make sure that people really know what the protocols are, what the intention is, and what's supposed to be done with them. So that will also be placed on the LMS. People will be pointed to the LMS to take that training and be able to provide certificates to all the various EMS agencies that they belong to. Other than that, I think the last thing we have is instructor courses. We currently have one instructor course that's going to be running this coming Sunday.
The
Right? It's
18th,
this Sunday, right?
yeah.
The 18th. All right, so that's an instructor update course. That's something that was severely lacking. Instructors need those. It's like CMEs for instructors in order to keep up to date. And we're looking at another one in January. That's all I got.
Excellent. Any questions for Morty? So, training and education has historically not had a significant amount of physician representation. If there's anybody that has the time that can help and contribute, I'm sure that Morty would be more than happy to accept any help that we're willing to give him. Okay. Next, Regional Council update. Dr. Langston.
There is no report because there was no quorum at the last regional council meeting.
Excellent, that's gonna work.
I knew you
CMAC
loved that.
update,
There was no meeting
Dr.
this
Marshall.
There's no new update there, CMAC.
Yes. All right, any unfinished business? All right, seeing none, any new business? Dr. Wire.
Yes, I wanted to just bring people's attention to the fact that the evidence-based healthcare section of the New York Academy of Medicine, which I co-chair, is planning a one-day symposium conference on the opioid crisis. And we're open to individuals and organizations in partnership on this. It should be exciting. We think that EMS should be an important presence in the event. One specific thing where we could use some input into is the date. We're thinking in terms of May of 2019. We were thinking in terms of the EMS week, the 20th. But thinking further, that could be more of a liability than an asset, depending on other obligations that people have. But if there are specific days that would be particularly conducive to EMS participation, we're open to that. If individuals are particularly interested in this, send me an email. It's pwire1@gmail. And that's basically it. We expect to be working with the New York City DOH on this, and
I'm sorry, what was the topic of this?
the
I missed it.
opioid crisis.
Opioid
aspects of it.
Yeah, and Dr. Wire, I think it might be helpful if you could send the information about this to the region. We can then send it out to everybody and maybe help with a date for you. See if that makes it a little bit easier.
And again, if there are individuals who are particularly fired up on this, send me a personal email.
Perfect. Great, thank you. The last thing I wanted to mention before we hopefully adjourn, we're in the process of revising the bylaws. We've met twice. We hope to have bylaws to be presented in January so that they can make it and hopefully get through the 3 meetings that we need in order to be able to pass those changes. So I would look for it in January for us to have these revisions somewhat complete and at least come up forward for the first public discussion. Any questions? I see Marie has one,
Not about this.
besides Marie. All right, anybody want to, I'm kidding, go ahead.
Okay, those people who are on the protocol committee received a copy of the recall on the epi dosing.
Check and inject.
It's check and inject, but it goes beyond that. There was a recall that has shown that there's an error in our protocol and in the state protocol. We're talking about the same thing?
Yeah, the FDA notified Boundtree that they were using a device that was not approved by the FDA in an off-label manner, and that was in the check and inject program. And their concern is that with the pediatric dose of 0.15 in patients who are less than 15 kilograms, that dose is too high. So they have recalled all of the check and inject kits, and Boundtree is supposed to be replacing these syringes with standard gradation syringes The department was supposed to reach out to the FDA today. I haven't heard back anything from them, but right now, we're using it off-label. So the recommendation is that we do not use off-label devices. So more to come.
Isn't the 0.15 the dose in the peds?
Yeah, there is a problem with our protocols because we don't make the distinction of patients under 15 kilograms.
Neither does,
Neither does the state.
yeah.
So,
It sounds like a
hold on,
protocol.
hold on. So Dr. Benelli and then Dr. Barber.
I'm just curious, how many years have we been maintaining this error?
I'm sorry?
How many years have we been doing check and inject?
Okay, so.
At
2
least
years,
Yeah,
about
just-
2 years.
And before that, the EpiPens were .15 also.
Right.
Yeah.
Yeah.
Those are FDA approved
All right.
first.
What is the recommended alternative?
That they,
A weight-based dose?
Yes.
So the idea is to potentially underdose anaphylaxis at the expense of maybe overdosing with the standard of care that is EpiPen Junior.
for the protocol discussion, the issue is that for patients under 15 kilograms, that medical control be contacted. Nothing has been finalized or even recommended yet, that's just the discussion. In terms of our protocols, we should just go back and look at them. But you're right, the EpiPen is .15 and.
Negates the whole purpose of switching to injecting.
So, again, I think that this might,
This is a huge safety issue.
guys,
Yeah.
guys, all right, listen, we're just reporting the information. So, let's get through that. This is what the FDA is saying, it's off-label, we have to address it, we have to look at it. Will we say that we want to do the same thing and we think it's the best thing medically? We could still do that, but that's where we're up to. Dr. Benelli.
Just wondering if, even if we contact OLMC, if there's gonna be any OLMC physician over here around this table who would deny using the.
Again, I think that you're correct. I think we have to review it. We might want to say that that is our feelings and send that to the state. But we have to at least go through the process of looking at it.
But the question, if the FDA says don't use it, you can't use it.
That's correct.
It's not your
You
choice.
can't use the
Right,
syringe.
you're gonna have to switch right off and go to
That's,
Right, so you have to switch to a regular graduated syringe and you could give the same dose, but you'd have to use the regular
As long as
syringe
people understand that
as
it's
opposed
not
to the
just
set one.
push them
No,
to,
that's
I've
not
already
What the
been there.
state said.
but that's not, the FDA never approved, for instance, King LT for use in the pre-hospital setting. I'm not sure that the FDA ever approved Zofran for use in the pre-hospital setting.
Okay, so
So we have to,
We did talk about it at protocol.
I think that's a very good point, and I think that we really need to discuss it and at least make a decision on the regional level what we want to do. To say that they didn't or they did is, I don't know if it's going to help us, but we do have to discuss it at protocol. So Dr. Van Voorhees, if you can add that to the next agenda item, that would be great.
Has this
Yes.
been sent out to the agencies, because I'm aware of at least 3 or 4 agencies that are doing check and check right now, so.
Not yet, because I'm waiting
Downtree-
for-
Downtree sent it out to everybody
Yeah.
that bought it from them.
So yes.
Can we blame the Maryland?
Along with the
Is
FDA.
is it just me or is
The one they fired, right?
like why recall physical devices when it seems to me like there's an issue where we need to amend our protocol, right? Like if we amended our
Yeah.
protocol, wouldn't that become?
You can't really amend it for BLS because it's beyond the scope of practice for an EMT to do weight-based dosing. The only thing you can do is say you can't give epi to infants under 15 kilograms. That really is the only fix for BLS. ALS has no problem because we're already doing weight-based dosing.
This specifically has to do with the check and inject program. And you're asking somebody who has minimal training to decide, to pull up that much, and if you're gonna give it overdose I mean, again, would we probably do it anyway? We probably would, but that's what their concern is, and that's what came to us. So we'll discuss the protocol, and I think that's the next step.
Yep.
And in the meantime, the advice to the agencies for checking the check?
I think Boundtree has sent out letters saying that you have to pull it.
Yeah.
Or you have to pull the syringe at least, but again, I don't know what a BLS
We
would do
need
with
to say the
that.
same thing. I think we need to send that.
I think we, so,
Can we resend out the Boundtree memo as,
as a
as
regional
informational
advisory.
from a regional advisory? Yeah.
Okay, so that's what we will do. Any further discussion on the check and inject epinephrine conundrum. I try. Any additional new business? Seeing none, I will entertain Marty's motion to adjourn. Thank you, everybody.
Happy Thanksgiving, everyone.
Happy Thanksgiving and happy Merry Christmas for those of you